Hi everybody, it's me, Bianca from Manhattan Physical Therapy, and I wanted to come here to talk about why our back pain might not be getting better. A lot of the time we have patients coming in and they've been dealing with chronic back pain for years and they haven't been able to get to the root of it. Well, this is why I'm here today, to give you guys 4 reasons why your back pain might just not be getting better. Reason number 1. Oftentimes, people just don't keep up with their exercises. Having a consistent exercise routine is super important, especially strengthening your core. Your core is a vital stabilization muscle in the body. And oftentimes, when you have low back pain, most of the time we see a little bit of lordosis in our low back. When you have lordosis, you have a slight curvature of the spine. That causes the vertebrae to compress on one another, causing sharp pain or consistent pain that you guys have. So it's super important to strengthen our core, because when our core isn't strong enough, our core can't bring us into neutral position. So we want to make sure that we're contracting the core muscles to pull us in to alleviate the pressure on our spine. When our core is taking most of the work, less of the work is going on our spine, causing less pain. So it's really important to have a consistent workout routine, especially prioritizing core strengthening. Another reason why our back just might not be getting better is because of our job. 99% of us have a desk job where we're sitting all day long. When we're constantly in that poor posture, that rounded position, it puts a lot of pressure on the spine, and the muscles around it are under a lot of pressure. That's also why it's super important to strengthen our core, to make sure even when we're sitting, our core is engaged and our back takes less of the brunt. Let's say you're a patient coming in and you've tried physical therapy before and it just didn't do the trick. Well, hate to break it to you, but the average PT clinic won't cut it. Just throwing a hot pack or an ice pack or electric stimulation is not going to solve your chronic pain that you've been having for years. That's why it's super important to make sure you're prioritizing strengthening, but it's hard to strengthen when you're in extreme pain, when you don't have the strength initially. That's why here we have red cord therapy, which is this guy. Red cord therapy is super helpful because the way it works, it's suspension therapy. It suspends different parts of your body, so we're able to really isolate and focus on the specific muscles that we want to strengthen without putting you in any sort of pain. Oftentimes when you have back pain, you can't even do a squat. You can barely stand or walk without pain. When you're on this, we're able to strengthen, and it is a pain-free zone. That's why it's imperative when you're choosing a physical therapy practice that you're choosing a place that is curating a perfect treatment plan for your needs that won't exacerbate your symptoms or push you to the side. Another reason why your back pain just isn't getting better is because most of the time it's degenerative. It's just wear and tear over years and years of not getting it treated. When that's the case, we like to work with a team of professionals where when physical therapy isn't helping, we can send you out to a pain management doctor, we can send you out to a spinal doctor to get some imaging done, or for a spinal consult to see what the real root of the problem is and to get it treated. If this sounds like you and you've had back pain for years and years and years, come into physical therapy and let us help.